Good morning, ma'am. My name is John Mark Baroro Mojado. Then today for the return demonstration, so I will be assisting the ear, nose, mouth, throat, and sinus assessment. So the purpose for this is to first is to obtain the baseline data about the client's functional abilities. Second is to obtain data will help the nurse establish diagnosis and plan the client's care. So the third is to evaluate the physiologic outcomes of healthcare and those the progress of a client's health problem. So the equipment for this is the tank depressor, pen light, or as if that this is a otoscope, then the tuning fork. So the procedure for this is the number one is the prepare the equipment needed to avoid some errors and orderly use of the materials. So second is the to identify the patient, explain the procedure and purpose to the client. So in order to avoid misidentification and giving information and makes the patient cooperate. So third is to wash hands and observes infection control and sanitize first to avoid the preventing the spread of bacteria and viruses. So first I would like to wash my hands. So then second, I will wear my surgical gloves to avoid the transmission of bacteria and viruses. No? So, sorry for waiting, mom. So when it comes up using gloves, so this is very struggling. Okay, fine. So, hi ma'am, good morning. My name is John Mark Baroro Mojado. Then I am your nurse for today. So, I'll be assessing your data, ma'am. So, please, sorry, ma'am. So, your name, ma'am, is
Brittany Saladag,
uh, your age,
19,
19. So, your address, ma'am.
Marcos at Lupi.
Okay, ma'am. Thank you, ma'am. So, for the air assessment, so number one, instruct the patient to sit the obtain proper position during the assessment. So ma'am, can you please sit down properly, ma'am, to obtain the proper positioning of your body? So, thank you, ma'am. So, then second, use your dominant hand to occlude the tragus part of the ear and position yourself on the opposite side. So, in order to assess the gross hearing of the patient. So, I use my dominant hand to test the tragus of the ear of the patient. So, it's okay to you, ma'am, that I will touch your ear, ma'am, your tragus part. So, okay, ma'am. Thank you, ma'am. Hello, ma'am. Here, ma'am. Okay, thank you, ma'am. So, okay, ma'am. So, three. Cover your mouth and say word that has at least three syllables like house, elephant, and summit. Then instruct the patient to repeat the words in order to prevent the patient from lip reading through her peripheral vision. So,
Elephant. House. Sound.
so okay, ma'am, thank you. You're normal, ma'am. Means come to your hearing. So, for Weber test, tap the tuning fork and place it firmly on the patient's head. Then, ask the client the location of where she hear it. So, a normal Weber test has equally So the normal Weber test has equally sound of heard by the patient. So, ma'am, so the normal Weber test has equally sound heard by the patient. So for this session, ma'am, so I will use the tuning fork to test your hearing, ma'am. So I will place it the tuning fork in your head, ma'am. So can you hear, ma'am? Which side, ma'am?
Both.
Left and right?
Yes.
So, thank you, ma'am. So for the rain test, position yourself on the patient's side and while the tapping or the tuning fork and press it against the masteroid process. So, ma'am, it's okay to you, ma'am. I will put the tuning fork in your masteroid process or behind of your ear, ma'am. So, thank you, ma'am. So, ma'am, where did you hear clearly, ma'am? On the outside or in this, which is I point the tuning fork, ma'am?
It's very professional.
So okay, ma'am. So, the side. So, where did you hear it clearly, ma'am? From the outside or where I did point the tuning fork?
Same.
So, okay, ma'am. Thank you. So, for this, then ask the client to verbalize if he hears it when the sound stops. So, remove the tuning fork and ask again of the patient if she hears the sound. So, from that session, so my patient replied to me that she hears it clearly when I tap the tuning fork on the left and the right side of their ear. So for the positive brain test, it still heard when the tuning fork is moved to the air near the air which air conductive or AC to be on the bone conduction. So okay, ma'am. Tuning fork. So I use the tuning fork, ma'am. So we'll do it again, ma'am, ha? Okay, ma'am. Sorry, ma'am. Did you hear it clearly, ma'am?
Yes.
So as usual, my patients did hear it clearly. So for the for this session, palpate the air for tenderness. For inspection, let the patient's air and up and the back. Place the otoscope on the tragus, then rotate it inwards. Inspect the canal for cerumen and inflammation, and swelling, foreign, and the body of the other lesions to assess the tympanic membrane and external auditory canal. So for this session, I use the otoscope or I use pen light for these sessions because I don't have any otoscope. So as use sa pagpanggap ito ay otoscope. So it's okay to ma'am that I will palpate your ear, ma'am, for the tenderness or any inflammation of your ear. Okay, ma'am. Okay, ma'am. So I observed that there's no any inflammation of the air of my patient in the stereo canal. So for the nose, tip the client's head back and use your dominant hand to position the head and hold the light. So the proper position gets easier access. So for this ma'am, so I would like to inspect your nose, ma'am. Okay tayo, ma'am. So your nose, ma'am, is in the proper lining, ma'am, or the midden. So then inspect the lining of the nares, mucosa, the pores of that filter the air. Observe the presence of redness, swelling, growth, and discharges. So the mucosa usually pink and clear watery discharges. So it's okay to you, ma'am, that I will inspect again your nose, ma'am, to see the mucosa or the hair of your nose is fine, ma'am, present. So, okay, ma'am. So, your mucosa, ma'am, is normal, ma'am, and the color of your nose, ma'am, is fine, ma'am. Na siya pinkish or redness, ma'am. So, then your hair on your nose, ma'am, kuan siya, ma'am, kanang naa siya, ma'am, normal. Wala na siya ni mag-wax, ma'am, or any other, ma'am. So, it's okay, ma'am, kay bad na siya, ma'am, kay mo na siya magsala sa atong hinigop or inhale na itong ginhaw, kuan, ma'am, sa atong pagginhawa. So, for the inspect the position or the nasal septum between the nasal chambers in the particular. Then, inspect the mucous membranes for purulent drainage and nasal polyps. Then, the nasal symptom is normally intact in the midline. So, it's okay to you, ma'am. I will inspect again your nose, ma'am. Okay, ma'am. It is the midline or nasal, ma'am. So, number 5, palpate the maxillary and frontal sinuses. So, the normal sinuses are not tender. So, ma'am, it's okay to you, ma'am, that I will palpate your nose, ma'am. So, okay, ma'am. It doesn't hurt, ma'am. Okay, ma'am. So, for the mouth assessment, so first the lips. So inspect for symmetry and contour, color, and texture. So lips are usually soft, moist, and smooth, and pink in color. So ma'am, I will inspect your lips, ma'am. Your lips, ma'am, is dry. Did you use any lip tint, ma'am, or lipstick? So okay, ma'am. So it is daily, ma'am.
Yes.
So I observed that, ma'am, your lips is dry. So we should limited to use, ma'am. Limitahan na to ang paggamit ng lip tint kasi nakasira ito ng lips. So your lips, ma'am, is pinkish color but dry, but has a dryness. So for the inner and vocal mucosa, so use tongue depressor to pull the lips and cheeks the part of the proper visualization. Carefully inspect for color, moisture, texture, and the presence of lesions such as ulcers and abrasives, lesions. So then to determine if the patient has the presence of lesions. So ma'am, it's okay to you, ma'am. I will inspect your mouth, ma'am, or your lips. So okay, ma'am. So ma'am, there's no other lesions, ma'am? There's no present of the lesions of your mouth, ma'am? So thank you, ma'am. So for the teeth and gums, so as the cheeks are retracted, the gums and teeth should be inspected. So the gums should inspect for bleeding, color, retraction, edema, and lesion. In order to assess the patient gums. So ma'am, can you please open your mouth, ma'am? Okay, ma'am. Your gum, ma'am, is pinkish, ma'am. It's normal. It's no other the presence of any lesions, ma'am. So for the examine of the teeth for color, presence of filling, dental caries, or the partial of the complete dentures. So antartar along the base of the teeth. So normally the teeth are white and shiny. So ma'am, can you please open again your mouth, ma'am? So your teeth, ma'am, is white and shiny, ma'am. So for the tongue and the floor of the mouth, so instruct the patient to open the mouth, stick out the tongue, and say ah. So for this session, ma'am, so can you open your mouth, ma'am, and And stick out your mouth and say ah. Ah, ma'am.
Ah.
Okay, ma'am. Can you stick out your mouth, ma'am? So, I use pen light to see it more clearly. Or the otoscope. Okay, ma'am. Oh, okay. So, using the pen light for illumination, inspect the tank for color, size, texture, position, mobility, and any coating. So, as I use the pen light or the tank depressor, so normally the tank is in inlining. So, and the moist and the slightly of the row of the surface is in present. So the moist or the midden is pinkish color in inside, then and the row of the surface and the whitish coating, so it's white and there is no present of the tartar of the heritage. So number 8, so inspect both palettes for then extend patient snake backward to visualize hard soft palette. Then inspect both palettes for color, shape, texture, and the presence of bony prominence. So normally, normal palette usually pink and rich hard palette. So ma'am, can I inspect again your mouth, ma'am? So can you please open, ma'am? Uh, sorry, your palette, ma'am, is normal. So the color is slightly pink and red. So for the oropharynx, so inspect the palatine arches or arc. Note for redness and lesions of the plaques. Inspect the tonsil for color, discharge, and size. So normally, pink smooth texture and discharge and normal size. So ma'am, for the last ma'am, can you please again open your mouth? And can you stick out your tongue, ma'am? Then ah. More, ma'am, more ah. So your arc, ma'am, is in the left and right, ma'am, is normal. Your ovula is in the center. So, okay, ma'am. Thank you, ma'am. So, the hair arc is in the normal size. So, in my observation, hair plaques and the ovula in the mouth is normal. So, and for this one, so before giving the observation the patient, so I remove my gloves. Hello. So remove the gloves and wash hands to avoid the spread of bacteria and viruses. So, hi ma'am, I'm back again ma'am. So, according to my observation ma'am about your head, your ears, and your mouth ma'am, so it has ma'am normal, but aside from your mouth ma'am, or your lips ma'am is dry ma'am because you are using any lip tint ma'am or lipstick. So, it's okay ma'am because you're a girl ma'am, so kanang hilig jud magamit ng mga babae mga lip tint para ignon sa mga lalaki pula og lips. So then kuan ma'am, so wala na ko ilaing nakita nga problem sa imong kuan ma'am. So normal tanan ma'am after your hair and your mouth ma'am. Then thank you for your cooperation ma'am, and that's all. Thank you. So thank you.